Chapter 10. Objectives. After reading this chapter, you should be able to 1. Define key terms introduced in this chapter. 2. Explain the physiological relationships between assessing and maintaining an open airway, assessing and ensuring adequate ventilation, and assessing and maintaining adequate circulation. 3. Describe the mechanics of ventilation. 4. Explain mechanisms that control the depth and rate of ventilation. 5. Explain the relationships between tidal volume, respiratory rate, minute volume, dead airspace, and alveolar ventilation. 6. Describe the physiology of pulmonary and circular respiration. 7. Recognize patients at risk for failure of the cardiopulmonary system. 8. Differentiate among adequate breathing, inadequate breathing, or respiratory failure, and respiratory arrest. Use information from the scene to size up, from the scene size up and patient assessment to anticipate hypoxia. Given a variety of scenarios, differentiate between patients who require artificial ventilation and those who do not. Identify patients who require administration of supplemental oxygen. Discuss the potential negative effects of positive pressure ventilation and how to minimize complications from positive pressure ventilation. Demonstrate the following techniques of artificial respiration for pediatric, as applicable, and adult medical and trauma patients: mouth to mask, 2 rescuer bag valve mask, 1 rescuer bag valve mask, or BVM, flow restricted oxygen powered ventilation device, automatic transport ventilator as permitted by the local protocol. 14. Assess the adequacy of artificial ventilations. 15. Modify artificial ventilation and oxygen techniques for patients with stomas. Discuss considerations for selecting the best device for delivering oxygen for a variety of patient scenarios. Demonstrate administration of oxygen by a non-rebreather mask and nasal cannula. Describe the purpose and the use of partial rebreather masks, Venturi masks, and tracheostomy masks. Demonstrate safe transport, storage, and use of oxygen. Describe the purpose of each part of an oxygen delivery system. Describe the use of humidified oxygen. By securing the airway, you provide an open pathway for air to move into and out of the body, as we discussed in the airway management chapter. However, a patent airway, the A of the ABCs, does not guarantee that the air will move, and it certainly does not guarantee that air will move in adequate volumes to support life. To ensure this, the EMT must assess breathing, or the B's of the ABCs. Recall that breathing accomplishes 2 essential functions: brings oxygen into the body and eliminates carbon dioxide. Although your body will tolerate the buildup of carbon dioxide longer than it will tolerate a lack of oxygen, both of these functions are absolutely necessary to support life. Proper airway management must always be paired with the assessment of adequate breathing to ensure that both of these critical functions are occurring. If you determine that the patient's breathing is not meeting the body's needs, then you must take immediate corrective action. A thorough primary assessment focuses on a rapid evaluation of both airway and breathing and identifies immediate life threats associated with the airway and the respiratory system. In this chapter, you will learn the skills necessary to correct inadequate breathing. However, it is just as important to learn the decision-making process that will tell you when to employ those skills. You must learn not just how to, but equally important, when to assist a patient with breathing.